commissioning the newly built primary health care center that Mainstream Foundation had built for Malale community. The previous small clinic that they had, because it was even a very small clinic, had been destroyed by water. A mini laboratory, and a pharmacy, which are the basic requirements for a primary health care center, with a delivery room and wards for both men and women and children. And so that is one of the best things about that particular outreach, because now the people in that community have a clinic that is well equipped to serve their purposes, as well as the purposes of those around the other communities around them that are close to them.
My name is Dr. Malale Saad. I'm the coordinator of this outreach. Actually, this young child fell down. He was among those that are supposed to be seen, and we suddenly saw him falling down and started having abnormal jerky movement. And those abnormal jerky movements, which he does with his hand and legs, with rolling of the eyes, associated with drooling of the saliva, and sometimes upward rolling of the eye. So all these symptoms are symptoms of what we call epilepsy.
There are a lot of interesting cases and a lot of complicated cases that needs attention. If we were not here, these cases would have been more complicated and we wouldn't have done much about it when they come in a late stage.
This case is called Kwashiorkor syndrome, and this one is always classified as malnutrition disease.
That we also treated children and dewormed all the children in the community that needed to be dewormed, as well as gave them vitamin A supplementations. These are very important aspects for children because worm infestation is one of the major causes of malnutrition in children. So been able to do that was a very good, it's a very good way of ensuring that the children at least get treated they only need to be treated in another 6 months again. So that will be good, and I'm sure we'll be able to provide that when the time comes.
We already have some cases that we know that we're coming back here to pick these women that need a mammography. We have a mammography in Mina, so we're going to come back here for them, take them to Mina, have the mammography done. There's one that has 3 lumps in her breast, so that has to be taken out, and then we'll pay for the biopsy to be done.
We were able to screen about over 200 women for breast and cervical cancer, and we were able to discover a few women with lumps. The aim of the screening exercise is to detect early cases of breast cancer, and as well as teach women how to do a self-breast examination that allows them to detect that there's a problem with their breasts. So we're able to detect a few people with lumps and problems with their breasts, which we have taken care of, and we're in the process of taking care of.
Some of the patients we saw, they can't move, they can't walk, and they can't take care of their families. With normal advice and the proper treatment, these people can come back to their activities and feed their family.
banda abin da zan ce musu sai dai in ce musu Allah ya saka musu da alheri domin aikin da suka yi muna mun ji daɗin aikin nan kwarai da aniya kuma Allah ya saka musu da alheri Allah ya biya su abin da nake da shi zan faɗa muku kenan
ya gane ko mai farin ciki da wannan kamfanin ubangiji Allah ɗauka shi Allah sa ya ci gaba da aiki mun gode Allah ya saka alheri sai jama'a
wannan asibiti ta ba mu abubuwa masu amfani sosai wanda yake tun kafin mu bata mun samu jin daɗi kuma mun fara ganin insha Allah waraka ta zo muna alfarma annabi insha Allah.
Mun gode ma Allah asibitin ga amfaninta da muke gani gare mu ko ina ya wakatar da mu da cikin asibitin ga da muna cikin yunwan sa yanzu kuma mun wakana cikin asibiti don ga ruwa ga gadaje ga komi wanda ake bukata mun samu.
Ina jin murna da godiyar asibitin ga da an kai ya min daɗi.
had once about 2 years ago, so which she didn't go to hospital till now. She was just applying herbal compost. From there, the wound became infected. It became an ulcer.
This has been really successful. This is the second time we're going to do this with Mainstream. We did this last year, and women that had complications and men that had complications were given referral to the general hospital. Between last year and this year, Raise Foundation and Mainstream had trained healthcare providers within the hospital management board in breast and cervical cancer screening. So you see, it's like we go like a step ahead every time with Mainstream to just fill up the gaps because government cannot do everything.
And we are managing the hospitals. Katamia Festival hospitals are managing Mainstream hospitals in Jeba and Kainji. And we are trying to upgrade the hospitals to a better level so that all these patients can come to our hospitals and even render better treatment.
Within our own reproductive health interventions, we do breast and cervical cancer screening. So that's what we're actually doing here today. Our foundation is offering those services for women to have breast and cervical, because women here have never had this breast and cervical cancer screening, which is very vital. The woman has to check herself regularly for lumps in her breast. You know, besides Mainstream and Raise Foundation, more NGOs have to reach out because government cannot do everything. And Nigeria is growing and growing. You have people out there that have never spoken to a doctor.
So far, we have worked very well with Mainstream Foundation. I think there's a mutual satisfaction on both ends, if I may speak for Mainstream Foundation, because I find that the more we work together, the more we want to partner, because we, like I said, we have common goals, which is to help those people in the grassroots to achieve the best form of health that they can achieve. And working together so far has yielded very wonderful results, and so we intend to continue the partnership.
So yes, we'll continue by God's grace.